Good morning. Dr. Stephanie Gray from Integrated Health and Hormone Clinic and Your Longevity Blueprint here today to talk to you about osteoporosis. So you may be aware that May is Osteoporosis Awareness Month. Osteoporosis is the most common bone disorder in America, occurring in 50% of women, and it leads to 1.5 million fractures per year. So risk factors for osteoporosis include being older, being a woman, also of thin stature, being of Caucasian or Asian ethnicity, not exercising, alcoholism, smoking, crash dieting, eating disorders, and nutritional deficiencies, especially like vitamin D or calcium, also increase risk. So how do you improve your bone mineral density? Well, first, you start now. Establishing a peak bone mineral density or peak bone mass by the age of even 20 years old is extremely important and may be one of the most important things you can do for strong bones in your elderly years. So peak bone density is achieved with regular weight-bearing exercises which force you to work against gravity. So these sort of exercises would be like hiking, jogging, climbing stairs, dancing, playing tennis, and even weightlifting, of course. Also, I recommend that you pitch the caffeine in the soft drinks. These are natural diuretics and they're robbing your body of the nutrients that your bones need. Additionally, carbonated beverages will also leach minerals from your bones, which isn't a good thing. And also find a provider to optimize your hormones. Replacing estrogen, progesterone, and testosterone in women, and then testosterone in men, can help reduce bone loss significantly. But also, what nutrients do you need for bone density? Well, everyone knows calcium is important, but you need more than calcium. So the nutrients that we talk about here at the clinic to help improve bone density above calcium are magnesium, vitamin D, K2, and even strontium. So let's start with vitamin D. Vitamin D is mentioned in many chapters of my book, Your Longevity Blueprint, and essentially it helps your body absorb calcium and even phosphorus from the foods you eat. And also, without enough magnesium, calcium can collect in the wrong places in soft tissues and essentially cause arthritis, so nobody wants that. So we know magnesium is just as important as calcium, so is vitamin D. But a much overlooked nutrient for bone health is vitamin K. So low levels of K2 are directly related to poor bone mineral density. Know that K2 helps bind calcium into the bone, so K2 is also extremely important. And lastly, the mineral strontium at a dose of 1 gram per day has been shown in clinical trials to also significantly increase bone mineral density compared to placebo. So if you're looking for a well-rounded nutritional support for your bones, consider bone support. So this is a multivitamin, but it also has all of the nutrients that I just mentioned. It has D, it has K2, magnesium, calcium, and even strontium. Now strategically in this packet, or in this product, you have 2 packets to take per day. So we've divided calcium with the strontium. So you're taking one at one time of the day and the other at the latter, because those 2 minerals compete for binding sites. So you really only want to take one at a time. So note to self, don't take calcium and strontium in the same mouthful. You want to divide those. So I hope you learned something today on bone density. You certainly can check out my blog at yourlongevityblueprint.com. Your bones need more than calcium. And if you learned something today, check out our products, research more, and please share this video. So know that wellness is waiting.